It is Health Diary. My name is Gladys Gashanja and we're coming to you from the Clarence House here in Westlands. Now, the World Health Organization estimates that 9.6 million people succumbed to cancer in 2018, making it the leading cause of death worldwide. Now, on the list of the most common cancers, prostate cancer comes number 4. Here in Kenya, the Ministry of Health alludes that more men are being afflicted by prostate cancer, and actually 1,000 new cases are being diagnosed on an annual basis. So today we have that conversation on why these numbers are getting higher and higher and what we can do to curtail the deaths related to the same. But before we get to it, here now is the fact of the matter. Prostate cancer is one of the most common types of cancer in men. It occurs in the prostate, a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. Men with prostate cancer often have prostate-specific antigen PSA levels higher than 4, although cancer is a possibility at any PSA level. Prostate cancer may cause no signs or symptoms in its early stages and may only be detected at an advanced stage. In Kenya, over 800 deaths are attributed to prostate cancer. Early detection of prostate cancer when it's still confined to the prostate gland has a better chance of successful treatment.
The year 2010, I began experiencing problem in my urine. It was too frequent. I could go to toilet almost 6 times a night. That caused me concern. So I went to see a doctor. I was examined again for PSA and they found it's 128. So they suspected cancer. I didn't believe that. I went for another test after 1 week. It was 148. The doctor told me, this is dangerous, you must get down for treatment. By October, they started treatment. They started with radiotherapy. This was about 35 sessions. After that, they started hormonal therapy. What I'm doing now is purely management. Management involves suppressing the hormones so that the cancer cells do not have what to eat because they live on the hormones. Unfortunately, during the time when mine was diagnosed, I met all the things for my own pocket. That means my relatives and friends, because the NHI was not covering it that time. At the moment, I hope they are covering it, but for management, they are not. Treatment, they are covering a part of it. Life is precious, don't take it for granted. That thing I've learned, and my life is changed. I live positively, and I fight cancer positively. I would advise all men to go for screening every year, irrespective of your age.
Well, prostate cancer kills many men in Kenya and across the world, but of importance is to note that this male-only disease is actually curable if it is detected early. Now, to delve into that world with me is Charles Motero, who is a prostate cancer survivor, and Dr. Gladwell Kiri, who is a medical oncologist. Thank you for joining me this morning. Now, Dr. 1,000 new cases of prostate cancer being reported annually, and I hear the number could be more than that because many do not come out to get the right diagnosis. Why are the numbers higher and getting higher by the day?
Now, actually, the number for the GloboCan data for 2017-2018 was actually around almost 2,800 new cases of prostate cancer in Kenya. That makes almost 6% of all diagnoses of cancer made in the country, and about 14% of cases in men alone. Now, I think prostate cancer was always there. You'd say the increase in number is what we'd call a measurement bias. We now have facilities of doing the blood test doing biopsies using image guidance. So if you look for something, you will find it.
Now, Charles, when and how was this diagnosed for you? Because the test is what makes men shy away from doing this.
It was in 2013 I started realizing that I had some problems of discharging my urine. I went to Mpisha Hospital and I was given some tablets which they said that it was just relaxation. I went back in late 2014 and the doctor this time referred me to a specialist, that is the urologist. When I went to the urologist, he recommended for 4 types of tests. In that discussion, there was a slip of the tongue that if biopsy is not properly done, you can die. So I decided not to attend for those tests.
Daktari, again, the biggest impediment, as you're hearing, is that screening and the testing and the procedure around it. What's your experience?
Now, the prostate gland is just below the bladder. It encircles the bladder and it's very close to the rectum. So when doctors use their finger up the rectal canal, they can actually feel a big prostate. And it's a very easy test to do because you're not cutting the patient. It actually causes no harm other probably than the emotional, what you'd call emotional stigma for men. But it's a very easy test to do and cheap as well. But of course, that would be a big problem for many men culturally.
Yeah.
Yeah.
Okay, speaking of it, you had all these tests you needed to do. There was a slip of a tongue that if something went wrong, it could be the end of it. What happened after that and what options did you take?
I went back to the chemist, bought the drugs that were prescribed to me, and started continuing with it, thinking that everything will be cured. But after some times, I realized this thing is not working. That is the time I decided now to look for an alternative doctor. I found another doctor. When he went through my record, he recommended the same thing. First of all, he started by asking me to go for PSA test. This time, the PSA was 36.6. I even didn't know what is the range. I went for ultrasound, I went for CT scan, MRI, and the biopsy. I brought it back to him, but on the way I read the report. And I discovered these things are not very good. Because according to the report, I had what you call peripheral cancer.
You talked about there being a culture and gender impediment to getting the tests done. But I also understand that there is debate amongst health practitioners about the benefits and the risks of doing prostate cancer screening.
Now, I think in our setup, that discussion, Gladys, may not be very applicable to us because most of our diagnosis is actually made late. Most of our patients already have metastatic cancer. What we should be encouraging health practitioners is to have a high index of suspicion, test PSA, do biopsies in men and treat them. But you raise a very important point about a screening test. Screening tests can also be troublesome in the fact that they can label you as having cancer when you don't. Now, screening tests and tumor markers, as PSA is, sometimes are non-specific. So there is a risk that you may label a patient to have cancer, yet he doesn't.
So you did a PSA test, 36, very high. You're at radiology and you have refused. Why?
When I did my MRI, my biopsy, you see that is piecing the muscles. So that wound had not healed. So you cannot start radiotherapy immediately before 6 months are over.
Now, a prostatic biopsy is done using an ultrasound through the rectum. Now, when you biopsy, you put the ultrasound probe in the rectum, you see the nodule, and a needle is introduced from the rectum into the prostate. So it goes through the urine channel, and you're introducing germs from the rectum into the urine stream. So there is a risk of infection, and it's quite a painful procedure. Now, because it's only a puncture, we actually don't wait 6 months for it to heal before we initiate treatment. Usually in a few days, that little puncture has healed. We usually warn them that they may have a little blood in urine. And now once we are very sure that they are not infected from the procedure, we're actually ready to go ahead with treatment.
How long after did you now start your radiology?
In our discussion, I expressed my feeling that I don't want to go through radiation in Kenya. I sold the opinion to her, and she did not object. So, as I continued with hormonal injections to lower the PSA, on the other side, I was preparing now to leave for India.
Are we actually saying we do not have young men with prostate cancer?
I do have some patients who are in their 40s, which is unusual. They are less in number, and of course the numbers increase as we grow older. In fact, old age is one of the biggest risk factor of prostate cancer, and it is said that in post-mortem evaluation of men between 70 and 90, a huge proportion will have undiagnosed prostate cancer. Older age is a risk factor of prostate cancer. Now, the screening test you're alluding to, the prostatic specific antigen, is just one of the tests that should be done in the diagnosis. So the blood test, a digital rectal exam, and then that will consequently be followed up by a biopsy, are still very, very important in the diagnostics of prostate cancer.
Is it possible to live a long life, whether diagnosed or not, without prostate cancer?
Yes, very possible. Of course, majority of Kenyans will not get prostate cancer, but we're saying that if you're a man, the risk is significant. We don't know which side of the statistic you will be, and it's very important to look for it because early prostate cancer is absolutely curable.
All right, we now take a short break on Health Diary, and when we come back, I've been reading that some types of prostate cancer can actually grow slowly and can go undetected, but others become more aggressive. Why? And also other questions will be coming up right after this break. Stay with us. Welcome back. Our conversation today, prostate cancer. It is the #1 killer for men, and in Kenya the biggest impediment is that most men do not go for that screening, so it is not caught early. Now, still with me, I have Charles Mutero, who is a prostate cancer survivor, and of course Dr. Gladwell Kere, who is a medical oncologist. Now, Dr. before we went to break, you were talking about some of the risk factors when it comes to prostate cancer. Let's talk about the genetic factor. What are the chances that if somebody in your family has whatever sort of cancer, that the men in that family are predisposed to prostate cancer?
Genetic factors are not very common in the risk profile of prostate cancer. We think age-related changes and other factors being more significant. Having said that, there are genetic mutations or inherited mutations that predispose certain family members to prostate cancer. Others are acquired or sporadic mutations. Now, you're born with a genetic inherited mutation, but not everybody with that mutation will develop cancer. And we think an environmental trigger also comes to play in people with these inherited genetic mutations.
For you, Charles, is there anyone else in your family who has cancer?
I don't know of any.
So you are the first case. It must have been a surprise and shock for many.
It was a shock because we don't have any history of that nature.
Remember that prostate cancer has a sexual connection in men. In our situation, maybe African men. So it is not common to find people like Charles who want to speak about their cancer. He may have people in his family who also have prostate cancer, but have not divulged this to other family members. That too is very common.
You decided to go for treatment outside the country, India, right?
Luckily, Daktari, I never mentioned to you that when I went to India and the result was red, they did not specifically identify cancer. But they discovered that that swelling could lead to cancer.
The way we treat cancer If we cannot be able to locally completely either remove it or radiate it, what we do is give what we call neoadjuvant treatment. That means that we shrink it completely, and in Charles's case, the cancer disappeared. And when he had his PET PSMA done in India, there was no identifiable malignant cell. But that didn't mean he didn't have cancer before. He did. It's just that the hormonal treatment had been very effective and there were no cancer cells to be picked up. And that's why we say prostate cancer is curable to a very high degree of certainty.
Now, Dr. there are complications that come with the prostate cancer treatments.
Yes.
It could spread, it could lead to erectile dysfunction, right? And also incontinence? Yes. Explain.
Now, when you use hormonal therapy, you completely remove testosterone from their circulation, and this leads to impotence or ability to have a sexual function. Now, that is quite different from infertility, because if you withdraw the treatment, they will regain sexual function and they remain fertile.
Charles, you made a choice to go to India and not get the treatment here. What informed that decision?
We have to admit, a doctor has to admit, that they are advanced in medicine than we are, extremely advanced. And therefore, some of these symptoms of vomiting, diarrhea, whatever, I never experienced it. Because their equipments are specific, they direct the beam of energy to only the specific area they want to treat.
Dr. are we saying we do not have these options in Kenya?
We've improved quite a bit. Some years ago, we also didn't have brachytherapy, which we also give to other stages of prostate cancer. Now we do. And the forms of radiotherapy are improving and improving. And probably in a few years, we'll have as much as India does.
How was the cost implication compared if you got the same treatment here?
I cannot talk about the cost because, first of all, my health comes first. And therefore, what it costed me and my life and the benefit from life to my family, I can't count.
Dr. I walking into your doors today, how does it look like cost-wise for somebody to get the full treatment for prostate cancer?
In the times when very few Kenyans had health insurance, the National Health Insurance Fund now has made these treatment and investigations accessible to very, very many Kenyans, whereas this was not the case before. There are certain forms of finer radiotherapy that probably people with very early disease would benefit from, so that they are less toxic because they are very targeted, are also more expensive than the other forms of radiotherapy.
Are those covered under probably insurance schemes?
Yes, the insurances will usually pay for them even abroad, as long as we make a case to show that this is what is best for this individual patient and this is not locally available.
Mm-hmm. After your diagnosis and treatment, are there things about your lifestyle you had to change? For example, your diet?
One, I reduced the consumption of sugar. I tried to avoid as much as possible the red meat. And I discovered that my pH was low because it was at 5.0. That means that my body was very much acidic. So you can only alkaline your body through fruits and some nuts and some juices of certain plants.
Is exercise part of your regime?
I don't want to cheat you, me, I don't do a lot of exercise.
Okay, Dr. I think at this point, your medical overview on what people can do to prevent this.
Be healthy, avoid being overweight, don't smoke, exercise regular, because that will bring far-reaching health benefits other than just preventing cancer. The truth is that one may not prevent themselves from getting cancer. And many of the cancer patients I have are actually healthy, exercise, people who exercise regularly, they are not overweight, they are very well toned and they go to the gym. And you see, the most important thing is actually to make an early diagnosis. Early prostate cancer has an 100% 5-year survival pattern.
What do you think should be put in place in health facilities to encourage men to come out and do early screening?
I can only advise men, wherever they are, they make a doctor afraid. When I came from India, I held a discussion with more than 50 men, and many of them took the opportunity to visit doctors or go for tests. And some of them, in fact, were treated.
But on a policy level, what needs to be put in place to help along in trying to curtail the huge numbers related or associated with prostate cancer?
Prostate cancer now being the commonest cause of mortality and morbidity in men in Kenya, a lot more investment, even in devolution county level, should be made in diagnosing and treating it. Now, having said what government can do for us, what can we do for ourselves and for government is to do like what Charles is doing. Create awareness. Come open with your story. A lot of people will identify with you silently or openly and actually make a life-changing decision to go and seek screening and seek treatment.
Well said. Dr. Gladwell Kiare, medical oncologist, and of course Charles Mutero, a prostate cancer survivor. And as you've heard, that if it is early detected, it actually can be curable. And even for the malignant ones, actually you can live a full life. Right, Dr.
Yes.
Okay. Well, that's where we wrap up the conversation. But before we call it a day, here now is a health tip.
When you do your sports, you watch your form. So you just start going down there, take it down slowly. Okay, down slowly. Make sure your chest is out, your back is straight. Then you put a minimal strain on your lower back. Avoid swinging like this when you're doing your biceps that way. That is wrong, okay? The right way is that way. Keep it straight, chest out, back straight, then work on your arms like that, okay? Slowly you can do counts of 10. For beginners, you can start with 8 reps of 3, slowly, like that.
It has been yet another episode of Health Diary. Thank you for your company, and remember, you can reach us on our social media handles for any questions and any comments. My name is Gladys Gashanja, and we've been coming to you from the Clarence House here in Westlands. Have a good time.